So welcome back. This is the third lesson we're going to have, and welcome to those people who are coming the first time here. And I would like to tell you guys, this is going to be the third lesson. We're going to have 5 lessons, and the 6th lesson will be an examination, and also we are going to explain the 52 common disease. And thanks for the gentleman, I think, that he always remind me of the common disease and also the names which match with the requirement for the grandparents examination. Okay, and for the last 2 sessions, we are happy to have two books, each book bearing about 11 common diseases. And today we are glad that because we just got 10 diseases, and each disease will be shorter. And then I also accept the advice from you gentlemen and ladies and gentlemen that the sometimes I will focus on the differentiation disease, and most of you are going to be the acupuncturist, right? The grandparents. So we'll talk about more on the acupuncture points, while the TCM will just give you the representative formula only, okay? And there will be no modification for that because required by the by the college. And last time I also informed you that there will be a sample case study in the website, and then I also make 2 copies to you, and 2 of you and get this copy. I mean, everybody can go up there and then go to the website about it. It gives you the requirement for that, and also there will be a question. You guys are lucky because you are going to answer 2 questions. Unlike in a Canadian exam, you need to answer 8 questions. And your question is easy because each time you just get the case study, and then you get what we call it the illness, prevention syndrome, and reason for diagnosis, treatment principles, and also treatment plan only. Okay, and those are you just need to fill in all the things, and then you will not ask why you use these herbs, why you are using this point. There's no need to no need to answer those questions, but you guys have to make what we call it the explanation. For example, you are using which point, and then you just get a general prescription for that. This is the samples. And we are going to do the examination on the 6th day, which you guys get about 7 questions, and we will do the questions together, and then I will give you the model answer, and then we have discussion. Okay, this is what we're going to do in the 6th lesson. Yeah, question.
I just want to know if it can be like open book.
Yeah. Sorry. I forgot to inform you. The reason for we run this course because we just want to equip you guys. We just want you to review all the information in internal medicine, including acupuncture and also the Chinese herbs. Right. The second is, since the examination is open book, you guys are bringing the book inside, right? Whenever you find a name which is similar to the topic, you can just open the book and then copy, or you just take me a reference for that, right? So what we are going to do is we're going to present the shortest paper just like this one, and then we got the name, and then we got the different types of disease, and we also got the acupuncture point and also the herb there, so that you can just summarize all the chapters in 1 page. And then we just have anytime just refer to this page is okay, right? So this is what we are going to do instead of crabbing through the book in this time. Okay, you can just refer to 1 piece of paper. This is what we are going to do. So the purpose of this one, as I mentioned before, just for review. And second, we want to prepare you guys to know the 52 common disease. And later on the 6th day, we'll just do some mock examination for you to prepare for that, right? So this is good for you to join this course. However, we are not going to go into each common disease detail, because if you want to join, just join the diploma of acupuncture, which we have about 2,100 hours, and the other is the diploma in TCM, Chinese traditional medicine, which is worth about 3,500 hours. This is really long for you, okay? So as grandparent members, you guys should be familiar with all this information. If not, you can just scratch the idea to revise this book, okay? Each day you get 1 book. So today you get 5 books. In addition, in total you get about 52 common disease, which will meet the requirement of the college to do it, okay? Good. So, any question? No. If no, we are waiting for the book. Yeah.
I told him a gentleman.
Yeah. Yeah.
He's going.
Yeah.
He's going to get it.
Yeah. And today, this is your textbook because I got it yesterday because I'm a teacher. You know, they just got me yesterday. We're going to, today what we're going to do is to talk about the tendon traumatology, and in short we can say this is pain management. In any college, pain management is a very important issue to deal with because.
Are we waiting for the book?
Yeah, you're waiting for the book. So while the time you're waiting for the book, I'll just start the first topic. We call it the headache.
When
Okay.
the first week I usually write the book.
Right. It's no problem. I think because they got another lecture over there, so the staff may be shortage in time for that. So I'm just asking you whether they are getting the book or not. Okay. Yeah. Just a moment.
Yeah, please.
Yeah. When I see.
I think he's getting it, don't worry.
No.
I'm gonna wire this.
Yeah. She's collecting the number of copies here. No problem. Okay, once you get the book, we can start. Okay. So any question you want to ask this time? So
The last paper, you said that the paper is short.
Yeah.
So what time we can have that?
I think we just prepare too, because we have just prepared everything while we are teaching. So it's no, don't have time to do it. The other thing is we have to prepare the questions for you. So don't worry, okay? I think before the end of the fifth lesson, I will give you all of that, okay? To go one by one. I just want to summarize everything to you so you guys have time to look at it, right? However, those topics are very important because I think among those 52, the council will choose, 2 cases for you to for examination. Three questions. Yeah, in answer 3 questions. This is my information. Sorry. Okay. Since the topics are very simple with that, so each time we just introduce the introduction, and then we got the signs and symptoms, and also you guys know the signs and symptoms before you do the diagnosis. So that for diagnosis part, you guys have to write in it. I think it's important for you to do the diagnosis because I just get one sample from the other people who just finished that. You mentioned that first of all you will have a case study, and then you guys need to write the diagnosis. Yeah, you're welcome. And then we got the treatment principle. The treatment principle is very important because according to the diagnosis, you got the treatment principle. Chinese medicine is very important in 2 aspects. One, it is in holistic theory. That means we treat the whole people as a one, and also we treat the human being and also the nature as a unity. Okay. The second is differentiation of symptom. What do you mean by differentiation of symptom? It means that we always offer the treatment and we do the diagnosis after we finish the overall analysis of signs and symptoms. This is very important step. Okay. So diagnosis will be a very important part. You should know which according to a principle. Okay, this symptom will belong to either excess or deficiency, heat or cold, either interior and exterior, or yin and yang. And then after that, you know that which organ is responsible for that. Usually, when one disease, there should be more than one organ responsible for the disease. And what the Chinese medicine, different from the Western medicine theory, is the Chinese medicine will go into see which organ is the cause of that. Okay, while Western medicine will do just deal with the local part. This is our differences. And after diagnosis, we will make the treatment. What is treatment? You have to know all the word because for treatment principle, you have to know the 8 therapeutic method. Which 8? Which means that just like diaphoresis, emesis, the heat curing, and also we got the purging, purgation, and then we got the elimination, and also the harmonizing. We also got the tonification and the reduction. All those 8 methods you should do how to deal with that. For example, fire, you should know what is we have to subdue the fire. We have to overcome the food stagnation. Just like resolving the flame. All those things you have to do the terminology of that. Those we call it the treatment principle. Okay. And after the treatment principle, you have to know the treatment plan. Of course, there are 2 types of treatment plan. One is called the prescription acupuncture. the other is prescription by Chinese herb, right? So for those people who are majoring in acupuncture, just need to fulfill the part of acupuncture. For those people going to be the TCM practitioner, of course, you have to do both parts of acupuncture and also herbs together, right? And then you have to write some explanation. And within this book, you will have some explanation on those parts, for example, just in the acupuncture and also the Chinese herb there, right? So it's it's going to be the book here. Yeah, right. So then distributing the book, we will start the first topic on 头痛. You just write down.
They just write down your name.
Yeah.
But we haven't taken it.
Yeah, we take a roll call for that. And this book is better because we have both language together, right? And for those students, for those people who are attending this course at first time, I would like to reiterate the declaration on this book again, okay? And this book is edited by our college. The director of our college, Professor Wu, he had a declaration on page 3, saying that the purposes of this booklet is to help our OCTCM students to grasp the treatment method for these 52 these common diseases. And the treatment method listed in this booklet is neither the only nor the best method. Remember this one. It's not the best method, okay? Or not the only method. You can just refer to other reference book. And you should refer to other materials in order to make the best clinical choices. And also see this booklet said is study reference only. The author is not responsible for any exam or test readers take. That means don't have a misconception that after you finish this book you should pass examination. No guarantee, okay? No, you can just read the other book. Last one, this book is for study reference only. Author is not responsible for any clinical disputes because some cases, in the real cases when we are doing our student clinic, will be something different from here. And some, when you are practicing, you find the case is more complicated.
Can I just make a short announcement?
Yeah, sure.
Sorry. Our college is a science-free environment, so please, if you come next week, please do not use any sensitive products like perfume or like sense costume products. Thank you.
Yeah, thank you very much. Yeah, there's many people complain about that.
Yeah, thank you.
That's good. Yeah. So readers should under the practical, under the supervision, register TCM practitioner for or register acupuncturist. That means you guys are all also the registered member of the grandparents, so you should be qualified for that. So after I make this announcement, any questions? No? Okay, you got the book. Okay, as I mentioned before, today we are going to share about 10 cases, and we have enough time. The time from today is from 9 to 5. We have 4 hours in the morning from 9 to 1, and then we take a break. And from 2 to 5, we'll have 3 hours lecture. So during this time, if you have any questions, just raise up your hand, okay? And then we can get 1 or 2 breaks in the morning, depending on you guys. Sometimes if you feel tired, and then you can just get a break, okay? For the usual regulation, we take one break per hour. But for me, I usually just take about 1.5 hours, something like, okay? So let's start, okay? Good. So what we are going to share today is the tendon traumatology or the pain management. That means we're talking about different kind of pain. So the first one we call it the headache. Headache is a very important issue in our daily operation in our clinic. Because headache is a common disease for many symptoms, just like exterior symptom. And just take a seat, please. Exterior symptom, or sometimes because of the pressure, sometimes because of any kind of disease, and sometimes people suffer from the pressure, the tumor that they have regard to get a headache, right? So when we summarize all the the symptom of differentiation syndrome, we got the headache always belong to two types. One is because of the exterior syndrome, the other type because of internal injury. Some people suffer from emotional injury. We also have exhibit the problem with the headache too. Okay, so first of all, let's talk about the exterior symptom, which we call the external contraction. Okay, in case you get headache here, and then for those practitioner in Chinese medicine or for those acupuncturists, is consider several points in our head. Okay, one is the the 保会. 保会 is the top here. We call it GV20. The other thing many people suffer is the 太阳. 太阳 is a special point. Okay, just 1 inch, just near the corner of our eye here, and then we got a 太阳. And since many headache because of wind, so we consider the 2 wind point in our behind our head here. We got the 风旗. Okay, and also 风府. The 风旗 is in GV20, and the other one is a 风府. 风府 is just 1 inch above our hairline, which is called 风府, but we didn't mention here, which is the the CV16. Okay, and of course, since the wind will come from the lung, we are going to consider the 离穴. This is LU7 here, and also in case some people get headache, there are many points for getting headache. Just like what? Just like the some people get headache the whole head. Some will get headache just in the front. Some will get at the top. Some will get at the both temple. Some will get at the back. So each of them will have his implication. Okay. However, the main point of this, just like GV20, HN5, GB20, about the 风旗 and the 缺, LU7, all 3 points. That means which point you feel painful, you can just make it. And yesterday we got a patient who get the tumor at the head. Okay, we also use a needle. The needle around the margin of the tumor, which is called the occiput. Or sometimes you can use the dermal needle to strike the margin of that to stimulate the cell around. Those are also the techniques for dealing with different types of headache. Okay, and for exterior symptom, we'll consider 2 types. You guys know that exterior symptom can be divided into wind cold or wind heat, depending on the type of symptom you got, right? As I mentioned before, wind is the leader of all evil. Wind can bring in everything in your body, just like cold, heat, dampness, and also the fire, okay? All those things can be caused by the wind. And if the wind is caused, if the symptom is caused by the exterior cold or exterior cold wind, and then we can just add 1 more wind point, which is BL12. BL12 is where? BL12 is just under your thigh joint, 2 T. 2 inches from it. And if you guys consider the thigh joint point is easy, right? And here is your backbone. Here's your backbone. And then between your shoulder point here, we got the T. This is the net 7, and this is the T1. Okay, between the net 7 and T1 here, and we got this point to the thigh joint. Thigh joint we got this is CV. This is the GV14. The GV14. Okay, this is thigh joint. And where is the 风门? 风门 is 2, this is T2 here. Okay, between T1 and T2 and T3 here, and then 1.5 inch lateral side from the T2. We got the 风门. Actually, the first one is 带虚, BL11, and then down BL11 we got another point BL12, which is 风门. According to the Chinese name, 风 means the wind. So anytime you see FENG, okay, this term, FENG, that means wind, and FENG, that means wind. So anything we start FENG, that means concerned about feng, that means the wind. So here, if you got the wind cold, we add one more point. Both side, 1.5 inch from the below of the second thoracic vertebrae. We got the 2 points. We call it the form BL12. Okay, and then besides acupuncture form, we are going to talk about the prescription in herbal. And then the herbs, we got 春根茶条散, 川松茶小糖, 川松茶小糖. What's that? I think the name is wrong. Okay, this one. Okay, I'll just give you the right. Because I'm majoring in Chinese first language. I feel uneasy to look at this name. Okay, 这个川松 is ONG 茶条小. Okay, so this name. So there's a mistake here. 川松茶条糖 should be this one. This okay, 松子细高汤. This one. Please correct this one. Okay, I'm not sure. Yeah, please stop with that. Okay, and then dealing with question.
Okay, so you're talking right now, I'm just trying to understand what's going on.
Yeah.
You're talking about wind cold, you're talking about the herbal prescription.
Exactly. And the name is wrong here.
Okay, so then that's like page 16, so we're no longer here. I'm sorry, I'm just confused.
Okay.
Sorry.
Yeah, this is good. I'm talking about which one?
You're talking wind cold, right? Headache
Yeah.
and herbal prescription, is that correct?
Oh, sorry. This one. Which page I'm on?
Yeah, I'm not sure.
Yeah, that's right. You're right. Let me see what's wrong with this one.
Okay. Good.
Yeah. I know. I know. I was wondering why there's no introduction, nothing, and then we talk about this part because yeah, you're right. I think they made mistake. Yeah, this is the first one they make mistake to me. So that's around there. Okay. Yeah, you're right.
Okay, so.
So what's wrong with that? Yeah, this one. Okay, let me see what's wrong with that.
Okay.
Yeah, thank you very much. That's involving in my teaching, but I don't know what does that mean. Okay. Yeah. Wrong. Yeah, this is the first page. I'm so sorry that. Okay, I stop everything here because somebody put the slide in. I just relying on. Okay. Yeah, as I mentioned before, headache is a very common, symptom for many, some symptom for many symptoms. And then anything just like, we're starting from page 1. Okay, and then starting from the page of this.
6.
Yeah, page 6. Thank you. Page 6. Yeah. Yeah, page 6, you're right. I'm so sorry because somebody put those slides when the fun I make confused. Okay, and there are 2 types of symptoms we're going to deal with. One is the exterior symptom, the other is internal injury. And those 2 type of problem will also cause something the channels and collateral inside our head disorder. Okay, and also as I mentioned before. If any sickness, any illness will caused by the disorder of the qi and blood, okay, and also the disorder of the channels and the collateral there, and headache can also be found in many kinds of symptoms, just like hypertension or what we call it the vascular headache, and sometimes some kind of common disease, just like the Japanese encephalitis. And also we call them meningitis, all those things. And even some people suffer from the eye disease, such as glaucoma. We get the head disease. You know why? Because they are the balance of the pressure. If the eye get the high pressure inside the eyeball, and then you get the some kind of headache or even nausea feeling. That okay. So this is very common. And when we mention about usually we in each chapter we usually deal with the introduction first, and then we talk about etiology, means the cause of disease, and then pathogenesis. And here, the headache can be caused by exterior symptom and internal injury. Internal injury, as I mentioned before, and they can be divided into different, different differentiation of the different symptoms. Just like a wind cold, also with a wind dampness and then wind heat. and this is because of those pathogens, disturbing our, the orifices, and also causing ourselves feeling, discomfort. And this discomfort will cause a headache. Headache is also because of not enough blood supplying to our brain, so that we feel headache. Sometimes because of the blockage of qi and blood. In this case, in internal injury, because of emotional disturbance or eating disorder, or some people may suffer from weak constitution, just like the lacking of blood and qi. And then the most common case will be the prolonged disease. Many people suffer from disease for a long time. Of course, in this case, qi and blood will be deficiency, right? So when you're explaining that, you just tell the reason why. And then, of course, the main cause will be the qi and blood deficiency. This is very, very common. Anytime you got, any reason, I think the mostly basically will go back to the qi and blood problem. And this qi and blood insufficiency cannot nourish our brain, cannot nourish our mind, and then we got this problem. Or as we mentioned in disorder, people to overeat too much the greasy food, spicy food, and also the sweet and food, especially those sweety food. As I mentioned before, if you guys get any phlegm during your coughing, don't take chocolate, candy, and also cheese, because those things will induce much more phlegm inside your body, because it will cause more dampness inside, right? And this dampness will, of course, sometimes you block your visceral, and also you block the cholesterol inside your body. And sometimes it's caused by external trauma, just like people falling down. So when I talk about the osteoporosis, the problem of osteoporosis, and we also advise the patients, don't try to do any housework if you're too old, because when you fall down, you will cause some type of external trauma. It will make you lie on the bed, and sometimes about 30% of people suffer from osteoporosis die within 3 months or 6 months, because once they lie down, they're not going to get up, okay? And they will lose the will to get up, and then they will just lie down there until die. Okay, I think this is a very important concept for people to know that why you must keep yourself upright. Okay, if you why you must keep yourself balanced, otherwise you will fall down and makes you unwilling to work again. Okay, and also those external trauma will cause the the stagnation of qi and blood, and in this case it will cause the headache. So you can see that headache can be caused by many reasons. Okay, namely exterior symptom or internal injury. The internal injury can be caused by eating disorder or emotional disturbance, weak constitution, and long-term disease. So in this case, you guys have to grasp the cause for that. Okay, otherwise you don't know how to deal with that. And when we go to the differentiation syndrome, some people would like to say identification of patterns. Okay, as I mentioned before, identification of patterns is the same as a differentiation syndrome, because those are the important issue for Chinese medicine. Okay, first of all, let's deal with the external syndrome, that means exterior syndrome. And if we got the exterior syndrome, of course, as I mentioned before, there are 4 common characteristics for people getting exterior syndrome. Or when you are dealing with the patient, you have to take note of these 4 points. 1, the patient must get a headache. 2nd, you get a stiff neck. This neck is the bad neck. And 3, must get the shivering, or what we call it the chill. And the 4th one, floating pulse. Also, if you are dealing with the patients, you have to take care, should he or she have these 4 points. So headache will be one of them. You know why? Because of exterior syndrome. Since the qi and blood cannot go up into the brain, so due to the invasion of the wind, so the headache will happen. Okay, and this headache is different from others because the headache will radiate to the neck, so causing the neck stiffness in the neck. And this pain is different because it will last until to the neck, and then it will also the onset is very quick. And then, as I mentioned before, the wind concept in Chinese medicine is very important. Western medicine practitioners, they don't have the concept. They don't have the concept of wind. However, in Chinese medicine, we consider wind is a very important issue inside our body. What is wind? Wind is something happening in your body which can move very fast. You move here and there. Okay. So when we were talking about the B syndrome, means obstruction syndrome, we can know that what we call it the migratory syndrome is moving here and there. So this is caused by wind. And the other thing is, of course, because of the wind will happen very fast and also disappear fast. Just like what you have rashes. The rashes in the face suddenly happen and they suddenly disappear. Those are because of the wind. So here, wind here is denoted by something happen fast, and then by onset fast, right? Those external, when the wind is caused by external pathogenic factors, it will bring away all other evils, just as wind cold and wind heat. Okay, so let's consider wind cold first. Okay, anybody suffer from wind cold? As I mentioned before, 2 students here, when they suffer from mysterious syndrome, may exhibit different signs and symptoms. Okay, one of them may have a running nose, shivering, maybe have the other symptom just like cold limbs, and then the other symptom, the other guy may get the symptom of fever, also sore throat, and also the running nose with the sticky and yellow nasal discharge. So we can just use all the signs and symptoms to distinguish whether the guy suffer from wind cold or wind heat. Okay, so here wind cold, we got a symptom as just like aversion to cold or wind, and then not feeling thirsty, and when you consider the tongue condition, you can find the tongue is pale, and also the tongue cold always white. Okay, and the pulse is very distinguished, because for people suffering from the wind cold, they will have the floating and tight, or floating and slow, usually not slow, moderate. Floating and tight, floating moderate. Floating pulse always means wind or exterior syndrome. When you have a tight pulse, you usually refer to either cold or tight or pain. So when the patient suffer from a serious body pain or what is general body aching, and you usually exhibit some kind of disease just as a floating and tight pulse. Okay, and tight means everything locked inside, just like all the pores, sweat pore closed, and then the pathogen cannot come out, and you create a very, very heavy pressure to the skin. And this time, when you feel the pulse will be very tight. Okay, and for those people who suffer from wind heat, and you always have those 4 kinds of symptoms. That means what? It means headache, and then we get shivering, stiff neck, and also the floating pulse. However, people suffering from wind heat will have some more fever. Okay, although we have both fever and chill in both wind cold and wind heat, we can see that the people suffer from wind heat will have more fever than shivering. Though here the fever will be high, much more higher fever, and the patient would like to drink more water, and sometimes not all the way, right? Not all the time. You can see constipation and dark and scanty urine, but those are only in the Febrile disease. You can see that, okay? And of course, you can see the tongue condition will be white, yellow coat, tongue coat. Although the tongue color sometimes red, sometimes pale red, light red, sometimes light red. However, the coat is very easy to distinguish. And for the pulse, it's easy to distinguish now because patients suffer from wind heat should have floating and rapid pulse. What do you mean by rapid? When I'm teaching diagnosis, I know that during one breath, inhalation and exhalation, and then we got about 4 beats per time. When you have what we call the rapid, that means from 5 to 6. Okay, the usual number is about 80 to about 90, 80 to 95 per minute, and this is what we call the rapid. Okay, and besides wind cold, wind heat, we have wind dampness. And wind dampness is a very characteristic of that. You know why? Because whenever we suffer from dampness, we will have a feeling of headache, as if it's wrapped. whether by the bandage. Okay, sometimes whether by bandage you can have the feeling of this one. And besides, the headache it was whether by the bandage, you always get all the joints really tight, and then we have a heavy sensation of body. What does that mean? It means yesterday you get 120 pounds, today you get 120 pounds. How come today you feel much more heavy? Because you get, more tightness in your joints, and then you have spend more energy to move yourself, right? Just you get the something rust in your joints, and then you need some WD-40 to lubricate your body. And in this case, besides the heavy feeling of your head, and also the heavy feeling of your body, you also can see from your pulse and also your tongue. Your tongue is a bit what we call it. This is greasy, or what we call it slippery, a slippery tongue. And the pulse, of course, we call it soggy, S-O-G-G-Y. Soggy, what does that mean? This is very soft, just like snake. Okay, it's very soft. It's not hard enough. So whenever you get a soggy pulse, this is damp. Okay, as I mentioned, dampness is very difficult to deal with because the dampness can be external or internal. Okay, so here we've got the three types of the symptom in our exterior symptom. And then when we concern about the internal injury can be many types. Usually, the headache is a long-lasting. It's not rapid. Okay, and it will be sometimes on and off happen. Okay, when it happens, always comes with what? Comes with the dizziness, and also sometimes you get vertigo. Okay, and this is always stimulated or activated by some emotional disturbance, just like anger or worry, and then this headache will increase. Okay, so when we divide the headache due to internal injury into different types, first of all we concern about the organs. Which organ will cause this type of headache? This is the liver. Liver is very important, as I mentioned before. Women from the age of 13 to 49 are always affected by this organ. Okay, you know why? Because you've got the menstruation cycle. The menstruation cycle is always affected by the liver. Okay, so the liver can be easily go hyperactivity. We call it hyperactivity of liver yang. Sometimes the liver will get stress, and then this time we call it the liver qi stagnation. And sometimes the liver will suffer from lack of blood, so this time we call it the liver blood deficiency. And all those things will cause us the headache. And as the liver heat go up, it will become the liver fire. The liver fire will be very serious because the liver fire will cause many diseases, just like hypertension, just like the growing of, the enlargement of the lymphatic node inside our body, and then we can have all kinds of scopia here, all kinds of scopia in the breast, and then we get all the inflammation inside our body. Okay, those are caused by the liver yin and liver yang. And liver yin also sometimes we call it the stroke. So first of all let's consider the hyperactivity of liver yang. Many people get the headache because of liver yang. We always have besides headache, we call it the head as a feeling of this distension sensation, distension, and they get a blurred eyesight. The eye sometimes they got easy irritable. Of course, those people suffer from liver yang. We have a red face, and also his tongue all get red, and then the mouth. If whenever you get the bitter taste in the mouth, you always have the problem with liver. Okay, as I mentioned before, you get many tastes in your mouth. Either when you get up, you can taste your mouth. Either it's tasteless, sweet, bitter, sour. Okay, any kind of taste you can have. Whenever you have your bitter taste, it should more or less the problem with the liver. Okay, and there is a very special type of pulse condition for liver. Okay, which is wiry, W-I-R-E, wiry. Okay, and wiry pulse got many names. Some people call it to be taut, T-A-U-T, taut. Some people call this pulse string-like. So string-like pulse, wiry pulse, or taut pulse, all refer to one thing: is you are playing the bow and arrow, and you can get all the string. Or when you're playing piano, I say violin. So when you're playing the violin, then you get the string. Those strings are very tough. This say we call this type of pulse. We call the string-like, or we call it the we call it the pulse, the tough pulse. Okay, and this is very typical for the people who suffer from any disease in the liver. And besides the liver yang, we will consider about the liver yin. However, most of the time, besides liver yin deficiency, people will suffer. The yin will sometimes cause these problems to the kidney also. So whenever we have kidney yin deficiency, we always have liver yin deficiency. And why? Because we consider one symptom, which is called tinnitus. Many people consider tinnitus just the problem of the liver, but actually it's not. In our clinical experience, we always believe that tinnitus always associated with the liver and also kidney yin deficiency. In this case, if you want to make sure whether it's kidney yin deficiency, you can just see one more symptom, which is the loss and also the knee. Okay, because the kidney will govern our wrist. The lower and also the lower joint. So if you find the tinnitus, also with other symptoms, just like the weakness in your knee, and also you get soreness in your wrist and the lower loin position, and it should more or less the problem with the both liver and kidney. Okay, and of course another problem is for the man always have a problem of what we call the nocturnal emission or seminal emission. Okay, as I mentioned last time, for the teenagers always get nocturnal emission because of the just the development of the accessory organ. However, for people like over 55 or like me, and then you get nocturnal emission, that means surely the problem of the kidney yang deficiency. Okay, so it's associated with that. Sometimes kidney yin deficiency also causes those problems. Okay, so it's the problem of kidney yin. How do you confirm that whether this belongs to kidney yin or kidney yang? How do you confirm that this is belong to the liver or kidney? You can just verify by other symptoms, just like your tongue condition and your pulse condition. Okay, for yin deficiency, the pulse you always fine and rapid. But if you find the tongue wiry, if rapid, and then usually this is because of the liver. Okay, and the other thing is you can see the tongue. Usually, the typical tongue condition for yin deficiency is red tongue with no coat, or red tongue with the coat with a crack in the middle. Okay, sometimes the tongue will display the shape just like a pullet, just like the map. Can you see somebody's tongue looking like a map, and with a red tongue, and then you can just confirm. As I mentioned before, yin deficiency tongue can be 3 types. Okay, usually this is red tongue without coating, which is a more serious case. And the less serious case, you can see even as coating, there's a crack or feature in the middle, and then this is also yin deficiency. And the most serious case, of course, is no tongue coat at all, which will appear in those people who have a consumptive disease, just like a later stage of the hepatitis, later stage of the diabetes, or later stage of the AIDS, and it means the HIV. All those people exhibit those tongue with severe yin deficiency. Okay, this is really important. And the third type of the headache due to the internal injury is the qi and blood deficiency. You guys need to know that qi and blood deficiency is easy to distinguish. Why? If you don't have enough blood, your face will display pale in color, right? If you lack of blood, and then you have the feeling of dizziness, and then if you are poor eyesight and you have tinnitus, all those are because lack of blood. So here you can see that the first symptom should be dizziness. Either your lack of qi or blood. Why? Blood deficiency is significant. Why we are saying qi deficiency? Because qi is the leader of the blood, while the blood is the vessel of the qi. So if there's no qi, the blood cannot go up into the head, right? Cannot into the brain, and then the headache will result. And then what will be the difference between the headache in due to the qi and blood deficiency from others? We can find that this is always the headache, and the headache is in the top here. If you find the tip here, that means the headache happen around here. That means you are lacking of qi. But because this region is governed by Jie-yin. What is Jie-yin? Jie-yin, of course, is because the liver and also the pericardium is a Jie-yin position, right? So you have to tonify your blood in this case. And besides you have a headache in here, you also feel what? Listlessness. What is doing by listlessness? That means no spirit. Either you get up in the morning, you feel you're not willing to do anything, right? And the face, of course, is pale complexion. And the most important thing is when you work a little bit, do a little bit housework, and you feel really exhausted, right? Because you are qi deficiency. So many people come into our clinic complaining about while they're doing a little bit housework, they feel tired. Okay, this is because qi deficiency. Okay, even they walk a little bit they just walk uphill, they easily get shortness of breath. SOB. This is also a type of qi deficiency. Okay, and you see the tongue, of course, pale, and then the pulse. Yeah. Yeah.
This is the hand of all actually. Can you borrow your book too?
What?
Wait, the hand of all book. So
Yeah,
can you borrow?
Okay, no problem. Go ahead.
And I will give you another one next week.
Yeah. You're welcome. Yeah, just take a seat here. Yeah, thank you. I'm sorry, I just mentioned about the headache due to the internal injury. Okay, internal injury this side, and we have finished the hyperactivity of liver yang. We finished the deficiency of liver yin and also kidney yin, and then we are now in the topic of the qi and blood deficiency. As I mentioned before, if these people suffer from qi and blood deficiency, the pulse will be fine and weak. Okay? What does fine pulse mean? Fine pulse means deficiency. Okay? And this fine always refer to the qi deficiency. And weak, that means the pulse is forceless. In this case, they will display both qi and blood deficiency. And the fourth type of the headache due to internal injury is because of phlegm. As I mentioned before, phlegm can be two forms. One is actually you can find the phlegm in your throat. The other is there's formless. That means the disease belongs to the phlegm disease. However, you cannot find any disease in the throat, in the lung, nor in the spleen of a patient. However, we can just deal with those diseases by removing or resolving the phlegm, just as a mental disease, just as the epilepsy. All those things we can just use the phlegm moving method to deal with the case. Okay, so here if some people got the headache due to internal injury because of the phlegm turbid, and then he will got the feeling of the oppression in the chest, and then the head always get a little bit discomfortable. Okay, in this case you get a hazy dizziness, and also oppression in the chest and the abdomen. All those were the symptom of the headache due to the internal injury. And the tongue condition is very special for people suffering from phlegm, because this time you can see slippery and greasy. The greasy, that means it is moisture. The opposite of greasy is called curdy. C-U-R-D-Y means it's like the powder, but it is dry powder. But this time you can see it's wet, and also just like the secretion on the top of that. Okay, and besides that, there is also another type of reason of the headache. This is because of the stagnated blood. The stagnated blood inside the body always causes many problems, such as the general body aching, such as the headache, and such as many times you got the many other problems caused by the stagnated blood. Were very serious. Sometimes if you do not care about the stagnated blood, it will become stagnation of the tissue, and this stagnation will become malignant, and later on even the tumor and even the cancer. Okay, so don't let the stagnated blood stay in your body. Okay, this is very important. Okay, and later on we know that if you let this run, and then you can see what is the characteristic of those patients suffer from the headache due to general injury. They will always have a history of the injury in the head, and the pain there is stable, fixed. And why? How can you see? How can you know that people suffer from stagnation? You just see from the tongue. Usually you get a blue stain or purple stain on the top of the tongue, and then when you lift up the tongue, you can see the two, wing under there. We call it the hypoglossal vessel, and then again, usually when those hypoglossal wing get thicker, and also its associated wing get much more clear, and then this will be the sign for stagnation. And
Sorry, the book says dark and punished tongue. I'm assuming that means purple tongue.
Yeah, purple. That is very terrible. No, what type of tongue? I think this is a mistake. When you see the dark tongue, what does that mean? The black tongue usually because of two things. Either you change from white to gray and then to dark, that means extremely cold. Another thing is from red to yellow to blue and then to dark. That is the heat. So dark can be too extreme for that, right? But usually we don't say dark here. So you're right. I just overlooked the word there. So this is a purple, not punish. This is a purplish. Somebody made a mistake there. Thank you. Good. So based on the differentiation of symptom, and then we can just make a conclusion. Okay. Anybody get the pain here? Pain here. This is due to Yang Ming. You know what's the cause for headache here? No. Usually, what do you get here? Yang Ming means what? Two positions: stomach and also the large intestine. So why will you get headache here? Usually it's caused because of the constipation. Somebody have their bowel movement just 5 days or 4 days each, they will get headache here because the heat accumulate in the large intestine. Okay, this is Yang Ming position. Okay, and how about the all head around? How about when you get headache all around your head? What does that mean? This is because Taiyang. When people suffer from exterior syndrome, it's not only this side get painful, this side get painful, it's a whole head. So in this case, we're talking about the exterior syndrome, and you cause the Taiyang channel. Okay. How about the top? I just mentioned before, it's Jieyin. Jieyin is the liver and the pericardium. Pericardium. Okay. And then that means you are left blood in liver, you get here. How about both sides? This is the Xiaoyang. Which organ? Xiaoyang is the gallbladder. Okay, this gallbladder. Okay, how about the back? Let me get the back. The back is nobody knows. The back is Xiaoyin. Also the heart and also the kidney. And your heart and kidney here in this position in the back. How about those people getting from the headache just stay 1 point, not just anytime you get stimulation here. What does that mean? They also means the liver problem. Okay, sometimes you can contribute this one. So the book mentioned that the front head is Yang Ming. This is right. However, the both sides Xiaoyang is right, but at the back he mentioned about is because of Taiyang, and this is I think may not be right. I mean the back here also because of the Xiaoyin, that means the heart and kidney. When will you say this is Taiyang? As I mentioned before, either the whole head or you can get the both side of the spinal cord. That is the urinary bladder. Okay, urinary bladder channel, you get pain. So whenever you guys get exterior syndrome, you get the whole headache, and then you also get the shoulder, right? And these two sides, also the Taiyang. I mean the urinary bladder, and also this and the both side of the spinal cord is also belongs to the Taiyang channel. Okay, but I spend much time in the differentiation because I just want you guys to know every item of that, right? This is very important. Okay, how about the treatment? I mentioned this before in just start. Okay, I'm not going to spend more time. Usually, the principal points will be the GV20 and also the Taiyang special point, the Feng Qi. Everything start with F-E-N-G, Feng, that means the wind. And 雷缺 why you need the 雷缺? You guys remember every time you get exterior sunshine, there are two typical points. Remember, if in examination you ask it to treat those people. One is your Li4, okay? The other is Lu7, 雷缺. And the third point is your GV14. Those 3 points are typical for any exterior sunshine. Of course, you can exterior cold, exterior heat, right? Whenever you heat, please add Li11, okay? This is the 聚气, okay? Heat. And if you get more cold, and then you can add one more point, as mentioned before, 风门, getting rid of the wind, okay? So, and also consider these two as 风起, 风门, and also 风伏, as I mentioned in the start of this lecture, okay? And besides here, with just explanation, I just remind you that every time you have your treatment principle, and then after you have the treatment plan, you must add a little bit explanation of that. Like here, why we use 保会, why we use the 太阳, because these 2 points can direct the channel qi, okay? Why is 风门, 风池, because it's getting rid of it. Of course, you need not remember what are the whether it's a crossing point, or whether it's a low point, or whether this is a Yangling point, but you must know that those points are responsible for dispelling wind or promoting circulation. I think those are very important. Okay, just remember the term, just like wind dispelling, promoting blood circulation. Okay, and treating collateral and relief pain. I think those points are important. Okay, and also point, of course, can release the pain there. Okay, and besides exterior syndrome, we are talking about the internal injury. Again, the principal points will not be far away from 保会, GV20, okay, 风起. But this time we add 2 more points. One is 头尾. You know where is 头尾? 头尾, we just use the here, going up, and then use here to meet here, okay, go up and go around, just meet this spot. So 头尾 is this point, okay. This is for dealing with headache. Usually for any kind of headache, we deal with 头尾, and also we deal with 太阳, and also we deal with the 风起. Those we concern about, and this including the 保会, okay. And the other point is 足三里. If you guys are here yesterday, last Saturday, you will know that I always emphasize on the point of 足三里, ST36. Here, it's not only for the stomach, not only for the digestive system, also for the qi. Whenever you guys want to tonify yourself, qi, blood, kidney, remember the point ST36, which is very universal. As I mentioned before, many people, the TCM doctor, in old China, in ancient China, they always get the motivation at this point, yearly, throughout every day in the year, because they know that this point is one of the tonification points. Even you don't have any problem in the digestive system, even any problem in your body, you can just tonify this point in order to get long life. Okay, the life preservation. And then other supplementary points you can add, depending on which organ. For example, if you get hyperactivity in your liver, of course you consider your liver point. Which liver point can you get away the heat? This is the LR3. LR3 is the way you get rid of the liver fire, the liver heat. Although it's a little bit painful there, but 2 or 3, LR2 and LR3 will be considered. But usually we consider 3 because 3 is more gentle. If you get fire, we consider 2. 2 is more stimulation there, right? And the other thing, why do we have a Tai Chi? That means Ki3. Ki3 is for the kidney, okay? And then why do we consider this one? Because Ki3 is the water point of kidney. Why do we use kidney? Because kidney is water, and then we just like when there's a house on fire, the firemen come here just use the water. You get to pull off the fire. So kidney free is a good point for seeing the fire. How about the flame? The flame. If they had the cause of a flame, what are you going to do? Of course, we find the 2 flame points. One flame point is ST40. ST40 风龙. 风龙 is where? Just middle between here, and then middle between here, you get here, and then 2 finger from the middle bone here. Here, this is ST40, feng long. And also, we want to get rid of water. So like somebody have edema. We also consider the 2 water pond. One is the Yining Quan, SP9, Yining Quan. Yeah, this is very important. And besides ST9, some people also consider SP6, because SP6 is the point where 3 yin channel coincident together. This is also a good point. Although it's not listed in the textbook here,
Which
right?
one? Yeah.
SP6. SP6.
Yeah.
Yeah. He mentioned that if you got the stenoid blood, you got the SP6. This is right. However, why do we add the BL17? 格数. You know, 格数, when you consider the conference point, 格数is governing the blood inside the body. So when you guys want to tonify your blood, you consider 3 points. One is the SP10, 血海, SP10 here. Yeah, this here. Okay, this is for tonify your blood. Whenever people have blood problem here. The second is BL17. BL17 格数. 格数 is the point where what the blood will, concentrate there. And the third point is the GB39. GB39, some people say 绝骨, some people say is 悬中. GB39. So the 3 point is a good point for you to tonify your blood. Okay. Of course, you have to consider the heart and the best shoe. The heart shoe, just like BL, 15. Those are also for tonify the blood. So therefore, later on when you consider the blood deficiency, headache due to blood deficiency, you consider, as I mentioned before, SP10 and also 皮书. 皮书 is, the BL20. BL20 is the shoe point for the spleen. BL20 is shoe point for the spleen. Okay. Whenever we got the kidney deficiency, of course everybody knows that the kidney, best shoe for the kidney in the back is BL23. BL23. However, for people suffering from lower back pain, you have to tonify your BL23. Besides that, you consider your Mingman is DIL4. Yeah, DIL4 is also that means GV4. Okay, so those are important for the headache. That's why I said Western medicine practitioner always deal with head whenever they have headache, right? Deal with head. However, Chinese medicine is different. Whenever they have headache, we deal with the foot, with the back, and with the leg. All those things can also deal with the head. This is the difference between Chinese medicine and the Western medicine theory. Okay. So are there any questions here? No. I'm just going through all these 2 points. Those are important, right? Why do we choose Baohui? The GV20, because it is the brain and marrow, because it's the head. It governs the brain and marrow, okay? And the other thing is, why do we Tao Wei here? Because we want to get rid of the, we want to drug the channel, and also we want to push up the channel qi, the collateral qi. And feng qi, of course, will get rid of the wind. And of course, 竹山里, the ST36 is a universal one for the qi, blood, digestive system, spleen, anything. Okay, this is very important. Now, when we consider the headache because of Yang Ming, what we're going to do, we use the Tao Wei and Hegu. Hegu is this point. Why? Hegu is also an tonification point. Sometimes when you guys get the exterior symptom, we may use Hegu. However, when you get any problem in the head and also the face, even the teeth, and then we also may use a Hegu. This time, Hegu is a good point for dealing with the headache too. Okay, and if you get the Xiaoyang, that means two sides, right? What you're going to do, and then you will just deal with the head by using Zhugu. Zhugu is GBA. GBA, how can we measure Zhugu? Zhugu is here, from the ear up about 2 inches, about here, okay? We get Zhao Xuan here, here Zhugu. 足骨 here, right? You use 足骨. That means if you get the migraine, and then you can deal with the 风池, I mean the GB20 and the 足骨 here. And some people deal with this side,太阳 special point. And around here, this is for the migraine, okay? And also, besides the head, you can deal with other points to deal with your headache. This is 外观, okay? Here, you got the SJ6, and then you get the 外观. SJ6 is a good point for dealing with the headache too, okay? And when you have the headache due to 太阳, please add the 10-2. 10-2 is which point? You know, this is the BL10. You get BL12 and then going up BL10 here, right? And then, you know BL11 is the first super issue, and then BL12, as I mentioned before, is the the 风门. So you can just list all the points from the back here, right? And then you can get the BL12, BL11, and then BL10. Oh, actually, BL10 10 is also a point for dealing with the headache. The other point dealing with headache is here, just here. We got the 后期. Yeah, this 后期 is also dealing with the head and the neck. Head and the neck is SI3. You know, small intestine point get free. This first point here, second point here, 前骨, and the third point here. Okay, so SI3. SI3 just in the line here, okay, in the back. And here, if you got 结因 headache, that means the headache due to the lack of blood in the liver. Of course, we can add the 四神聪. 四神聪 is the 4 point around the 保会. That means about 1 inch around the GB20. Okay. This one, and then 1, 2, 3, 4, 1 inch, about that. And then this is 四神聪. And the 四神聪, this first one, always deal with the headache. Okay. Why do we add 太冲? 太冲, as you know, 太冲 belongs to the liver, right? So whenever you get the insufficient blood in your supply into your head, causing you headache, and then you can just consider 太冲. So 太冲 is 2 functions. One, it can release the heat. Second, it can release the pain in your head according to the lack of blood, okay? Because lacking of blood will cause what? Because wind. And Chinese medicine is very ridiculous, you know. Sometimes we got wind. What does wind cause? Wind can be brought outside. Wind can be caused inside. Why? Because insufficient blood will cause the wind. And then the wind will hinder the free flowing of the blood in the qi, okay? So, I'm so sorry that we spent about 1 hour, but I think this is good for us to deal with one case with the other. You can see the auricular acupuncture. This is not used here. I'm not going to spend time here. And sperm needle, the dermal needle, that means skin needle. You can just use the tape. I think this is good for people suffering from headache. Use the skin needle because it's more safer. Because you're not intruding into the skin. And some people being afraid of being needle, and then they can use those dermal needle to make the other side red in color, but no bleeding at all, right? This is more safe there. Okay. In remark, I just want to inform you that there are many reasons for the headache. If sometimes we cannot deal with the headache with one treatment or one kind of method, you can just think of the other. Just as when I was doing the treatment in my clinic, I would first consider using the herbs, and then later on I will just use herb and acupuncture together. If I can use both, I just refer to other people. You know why? Because some disease may not be caused by organs, some be caused by what? By the chiropractics, right? I mean the backbone. And then they will just refer there to cure the headache or other things you can. So this is good for us to refer the patient or other people if we cannot deal with that, okay? This is our responsibility, okay? And here you also mentioned about the headache. If some people appear the headache with unconsciousness and also stiff neck, and then be careful, because somebody will suffer from the external trauma, falling down from the height, and then they will have a headache, and this headache may cause them the people not equal in size, right? You know why? Because some need the blood and one of the brain and causing pupil not equal in the size. And this time it was sent into the hospital, right? Because it will be really dangerous for that, okay? And of course, it also inform you some kind of lifestyle during the time of treatment. Okay, after we finish the acupuncture, I will just inform you that for those people, they are going to attempt the TCM-P examination. Only representative formula is used, no modification, okay? So here, the first one, we use a 春宫茶调散, 春松茶调散 to cure the disease of the headache caused by the wind cold. This is representation, okay? So you remember this one. For the wind heat, we use the second formula, which is called the 松吉洗膏汤. 松吉洗膏汤, you can see that this is composed of three things. One is 圈松, 圈松 this is 松, 直 means 直, 拔子, 洗膏 is a kind of herb, we call it the crimson, okay? And when you're taking the tofu or pinka, it's something like that, okay? So this is the formula. And for dampness, of course, we have a very famous formula called the 松火心息汤, or the 降火 心息汤, which also is able to dissolve or get rid of the dampness inside the body. And for the disease caused by hyperactivity of liver young, we got a formula called the 天麻扣陈汤. 天麻 itself is very famous. You know, in Hong Kong, many housewives like to use 天麻 whenever they get headache. Yeah, 天麻, 圈松, and also 拔子, and then they boil with the fish head with the soup. And after they drink that, they will get rid of their headache because of the wind. And sometimes the headache caused by the kidney deficiency. This is seldom. We seldom with this case, but if you get it, we can have someone called 代保文卷, which is composed more similar as a 鹿地黄汤 plus the 党参 and also the 当归, 杜仲 and those things, okay? And if you're lacking of qi and blood, qi, you can have ginseng, blood, you can have 当归. So qi and blood, of course, we use these four gentlemen, I mean the 细菌鸡汤, and also the four substance, we call that the 西味汤, together. And 4 plus 4 to be 8. So totally we got the 八珍汤 means 8 pearl, I mean the 8 previous drop here. And about the phlegm, of course, there's a famous formula called the 半夏拔除天麻汤. Again, you see 天麻 itself is also famous for getting rid of the headache, okay? And 半夏and 拔除 is getting rid of the phlegm. So using the help for getting rid of the phlegm and also getting rid of the headache, we have this formula called the 半夏拔除天麻汤. Stagnated blood. Of course, the method to remove stagnated blood is to, to move the blood and also to remove the qi and activate the blood. And we have this formula called the 痛效活血汤. That means it will get through the orifices and also activate the blood. Okay, this is the end of this session. Okay, so any question? I'm so sorry that we spent about 1.5 hours here.
We don't get some green tea together?
No, green tea?
Yeah, because 川松茶调散.
You're right. When I was learning the 川松茶调散, so Mr. Hello? No? No. Yeah. Go ahead. Yeah. Okay, thank you. Yeah, I got it. Yeah, thank you. Yeah, you're right. When I was learning in the TCM college, you told me that there is a 西茶. However, there's no need for that. No, 西茶is just a substitute for that, but it's not in the original formula. Just remember the eight pieces. 川芎, 黄木. Yeah, take a 5 minutes break. Okay, 川芎, 川松, the 防风, 姜火, and also the 拔碱, and also the 西参, and others. You include the 荆芥, 薄荷, and also the 甘草. It's okay. There's no green tea there. No, there's no green. Thank you. You're welcome.
Are we taking a break?
Yeah, I'm taking 5 minutes break. Okay. Yeah, because we had to finish 5 this morning. Okay. Thank you.
Then